what I'm doing now.
This is Dr. Tamara. And you know, I don't even know how to pronounce her last name, Tamara.
Kurmanalieva.
Kormanalieva. Thank
Yeah.
you. And you've been one of my star um,
Testimony.
well, what's the word? Attendees for my seminars. You know, trainees.
Thank you.
And I brought my mother here to see you in your clinic. My mom had a recent stroke that affected her vision, and last week she was extraordinarily fatigued. Is that true?
That's
May
true.
I video you too?
Sure.
This is Lisa, who's attending to her at my sister's house.
Yes.
My sister lives in Newport Beach. And what did you notice today getting this ozone therapy from the good Dr.
Yeah,
Tamara?
She's more alert compared last week.
And how about compared to this morning?
Yes, that too. This morning was she's a little bit fatigued.
Yeah.
You could tell that she closed her eyes when she eats her breakfast.
And she's got life now.
Now she's perked up.
And Dr. Tamara, I'm going to put this on YouTube with your permission. And Mom,
Water. Yeah.
Mom, I have your permission to post this on the internet?
Sure.
I have to ask. Thanks, Mom. You've been doing ozone now since you came to train with us, right?
Yeah.
What are your thoughts? What kind of results do you see?
Wonderful results. People are healing from herpes, from cold sores easily. Cold, those acute infections are treated very wonderfully. Chronic infections need more treatments, of course, and they've been getting good results.
What do you think? You're new to the 10 pass. What are your thoughts on that? Have you done many?
I've done a few, but results are great. I had patients resolved acne in one day, just stopped acne.
We have seen acne get better just like that. Yes,
Yes.
we have too.
Headaches resolved at the end of the treatment.
What about sinus?
Sinus infections are controlled but need more treatment, like once a week. Depending if it's chronic sinus infection, then it's going to be once a week, 3-5 times maybe. Yeah.
And I want the viewer to know that you just did what we would call a 10 pass, although with my mom, because of her size,
We did 8 passes.
we did 8 passes on her, and there's vein issues. And that's what we did on her today. So you had high-dose ozone therapy, and we're trying to help you out with a recent stroke, which affected your vision.
Mm-hmm.
How do you feel right now, Mom?
I feel pretty good.
That's impressive for you to tell me you feel pretty good, because I haven't heard you say that in a couple weeks.
Right. So, we're going to do one step at a time.
And you're
Good.
you're 94.
I will be.
You'll be 94, right?
May.
In May, in just in 2 months,
Mm-hmm.
you'll be 94. Mom, thank you for letting me video you, because I'm going to put this up. I want everybody to know that there can be help even after a stroke. You've recovered nicely with what you've done so far, and I'm hoping
Mention the time.
in the
Today.
time right now.
Yes. 6.
Well, we did her. We've been here for 4 hours. It took a lot longer with you because of vein issues, but you did really good. I'm proud of you, Mom.
I'm glad you're proud of me. I'm proud of you, too.
Thank you, Mom. But what do
We
you,
can get up, and so we can get up. Yes.
Tamara? You notice that she's more alert as well.
Yeah, I noticed that she's more alert. She's easily answering questions,
Yep.
and she is, keeping her sense of humor.
Her sense of humor is incredible.
Yes.
Yes.
Wonderful.
She's cracking jokes. I love
Yeah.
it.
90, in your 90s.
There you
Keep
go.
a good sense of humor. Have one. If you don't have one, obtain it any way you can.
Great. Thank you, Mom. Lisa,
Yeah.
what was that what you just said?
Awake. She's awake.
You haven't seen this since you started.
No.
Oh,
This is a miracle cure.
she's got life and she's awake, right?
Mm-hmm. Yes.
This,
Make sure I'm smiling when you take my picture.
you are smiling, Mom, and you are really full of life right now.
Mm-hmm.
I'm impressed.
Yeah.
Yes,
Good.
I am.
I'm very surprised too. I'm very surprised.
Great. It's really nice when you can get your family on these too. Thank you, Mom.
You're welcome.
I can't believe what I'm seeing. Mom, can you get in that door?
Yes.
I can't believe what I'm seeing. How did that go compared to before, Mom?
I think it went better.
Great. I do too.
Miracle cure.
Well, she's not cured, but
I
she's
mean, for
a
tea,
miracle better.
Yes.
Lots better.
Yes.
Around.
It's currently after 10 o'clock this evening after my mom's treatment. On my video right now is Dr. Sherry Rowan, my sister, who is a world-class eye surgeon, and I'm saying that with all due respect to my sister.
Oh, thank you, Robert.
She's well known, and she just made a comment about my mother, who is still up at this time of night. What's your comment, Sherry?
Back off. I wish you could make me look better than I feel right now.
Well, let me do some ozone on you.
I just said that this is the best Mom's done in the 3 weeks since her stroke. She has not had one day yet, till today, where she hasn't required a nap. It's now, 10 o'clock? She's never been up. By 7 and 8 o'clock at night, she's exhausted normally and has to be in bed. It's 10 o'clock. She hasn't had a nap today. So I've always been a believer in my brother, and I'm totally not biased because I don't buy into everything just because somebody says it's true. But this is, as a witness, she's really different today. She has a lot of energy. She had a great day, and I'm really happy.
Thank you, sister. And I may post this?
Sure.
Thank you. Have a good night. I love you very much.
Thank you. I love you too.
Good night.
Good night.
Why don't you just shoot me up with ozone?
I didn't expect that one.
Don't post it. I was saying it's beyond remarkable, the energy level that my mom has today. After 4 hours of IV ozone and minerals and vitamins, it's the first time I feel like I have my mom back. She's been really a shell of herself for the last 3 weeks, and it's been depressing for her and for all of us to think that she won't have her perkiness back. And today she stayed up. She didn't require a nap. We went to a delicious Thai restaurant for dinner, and I'm just getting her in bed now, and it's 10 o'clock at night, and by 7 she was just, get me in bed. So that's 3 hours with no nap versus 3 hours later with no nap versus all day. She would have 2 or 3 long naps in the day. She would eat and be tired and eat and be tired and eat and be tired. So I'm beyond impressed. I'm actually amazed. So thank you to my brother for giving me my mom back.
Sherry, I want to thank you because I want the viewer to know you've always been open to alternative or integrative medicine, but you are a very, very orthodox eye surgeon. Mm-hmm. So for you to say this is very meaningful to me. I'm very grateful.
Well, you're welcome. I wouldn't say it if I didn't mean it, trust me.
I know that of you.
I really am a Western medicine doctor. I use evidence-based medicine for everything I do. And yet, we all know that there are other ways to heal. And I've always known this. And actually, you've helped me when I was younger. So I know that there are other ways to deal with things. And there's nothing that any conventional doctor really could have done that would have affected this change today. I don't think anybody would have known what to do, because I've been saying she's tired, she's weak, she doesn't have her energy, what can we do? And it's like, she'll just get better. It will take time. And I felt there had to be something more. So I can say it was like we were out to dinner like regular. It was amazing.
It was just like regular.
It was amazing.
And she ate twice as much as you.
Well, she always does. She says if she ever loses her appetite, then we'll know she's sick. But you know, she eats healthy, and she eats a lot, and she enjoys her food, but she didn't get tired after it. And she didn't make me feel like I had to rush her into bed. I mean, she was terrific. So we'll see how the next few weeks go, and I'll send you some posts on it. I'll give you a little update in the video, but this is really remarkable, and I'm thrilled.
Thank you.
You're welcome.
Lisa, what'd you say?
Amazing.
What
Look at her.
is amazing?
She is so up.
I'm so up.
Have you seen this before in the morning? I haven't been here,
No,
so I
she
didn't
was
know.
not like this yesterday and last week. She was not like this. She looked tired. That was last week and yesterday. And now when I came back here to work, look
I
at
look
her.
awake.
Very awake.
Very awake. Good. Okay.
You feel better?
Yeah.
We're gonna take a shower
When?
today after breakfast or after your OT.
Right.
Yeah.
Okay, well, Mom, I want the viewer to see these are olives that I grew, so you're eating them. Olives are good for you. And there's fruit. There's apples, oranges, blueberries, and bananas in there
I
for
eat
you for
like this
breakfast.
all the time,
Good.
Robert.
Well, that's
You know that.
That's what brought you to 94, Mom. And when you walked in, Lisa, you said, oh.
Yes, I did.
Okay.
I said it over and over again.